Hey guys, I have an update on Daisy. Come here, friend. Another update. We are actually getting worse than better as far as diagnosis, prognosis, whatever you want to call it. I've talked to both my doctor, who's gotten all the medical records from the emergency vet. I've talked to the emergency vet doctor, Amber Jane, stop it. And we don't have an answer, but what we have from both of them is telling me that her x-rays, her chest is gnarly looking. Now, the weird thing is that 6 weeks ago she had a dental. There was a 0 heart murmur at that time, and now she's at like a 5. I've asked the doctor if that can happen that quickly. She says it can, but there's got to be certain things, and a lot of these things do kind of possibly cause that. So like I said earlier, they don't believe the problem is actually coming from cardiac arrest, but they believe that that is actually a possibility. That is a possibility as a result of what's going on. The bigger concern we're having now because of the chest x-rays is we're afraid with her oxygen coming in that she needs to be completely oxygen dependent right now. And of course her carbon dioxide going out, if it gets above 60 or whatever this thing is, she's at 56 now. If it gets to that point, she has to be on a ventilator. At that point, almost every dog that ever goes on a ventilator never comes off of it. It's like $10,000 a day. It's not even, I couldn't even entertain doing that. As much as I love her, if she's never gonna come off of it, there's no point. They're talking, my one doctor, he said it's possible, and the other doctor at the emergency vet backed this up, but here we run into another dead end. It's possible this is a fungal infection. However she got it, who knows? And the reason that it's possible is because she comes from middle of Ohio, which is the beginning of what they call the fungal belt. So there's a lot of animals out in that Midwest area that get fungal infections. It's not very common back east. Nugget, honey, daddy's working here, come on. It's not very common back east to where they don't even have there's not a lot of places that actually even do the stuff or have a lot of experience in it as far as testing for it. So then again, we're looking at like $10,000 just to test it. I don't even know if I can get it around here, done around here. And that's if if it's nothing else, and then we have to just try to see if it's fungal. Cancer has been brought up, if it's possible that it's cancer. I don't personally know. I know cancer can spread rapidly, or it can be there for a long time and you not even know it, and all of a sudden just flare up like this and it's too late. Come here, sweetheart, I'm sorry. Dr. Yard, which is my emergency doctor, the one that's been hands-on with her, seems to think that this is a combination of what she calls ARDS, which is acute respiratory distress syndrome, combined with, well, that's in addition to, she thinks all this started with some kind of bronchitis, a chronic bronchitis. And I asked her, I've been asking like, how did she get it? You know, is it possible she got an infection from the from her dental? Is it possible that Romeo, Amber, please stop, babies. I'm talking. Amber, you're so bad. I'm sorry. What was that? Shit.
ARDS.
Yeah. What do we know? Oh, I was talking about the Amber. Please, it's bad enough. Shit. We were talking about the possibility of an infection from the dental causing this. Dr. Yard says there's really no possible chance of that. I mean, she said it's possible, but the problem with it that she doesn't think it could possibly be that is because almost always they will end up with an elevated temperature. Her temperature is below normal. They come in, she said, usually at like 105, 106 degree temperature. So you know there's it goes with the elevated white blood cell count. Rome, leave her be. Romeo, Amber. And I hate to say it, but anytime, Stephanie, when I'm doing this and they cut up like that, go ahead and film them for a second as I'm yelling at them, just so people can see what I'm talking about.
Okay.
Amber Jane. So I don't know, but here's where it gets even uglier. We're at the point now where we're 24 hours in. She's oxygen dependent. She can't come off of it. They're trying to find the supportive care, any kind of antibiotics. They're using all kind of meds for different things. I don't quite understand all of them, but I understand why she's doing this for this reason. That's why I hate medicine. You need this medicine to fix this medicine's problem. That's your cardiac problem from this medicine for the original problem. It's ridiculously stupid, but she's on all these damn medicines, including antibiotics. But she's been 24 hours now. We don't see any improvement. So the next 12 to 24 hours is going to tell the tale, guys. God, I do not want to do this tonight with you guys or tomorrow, because I don't think I have any options. If she can't get better, guys, sadly, this could be it. And I don't know. Amber, leave her be, sweetheart. She's just standing there too. Amber, leave her be. Stop it. You guys see why I get so annoyed with her. She'll just bark at the other dogs just because they're near her. So anyway, Amber, you're being a butt. But anyway, so yes, we got the next 12 to 24 hours. I'm sorry, I'm just all out of sorts. As you can see, I'm really agitated from all this. I'm upset, I'm nervous, I'm scared. Yeah, so it's not good vibes around here, guys, but I will get back to you as soon as we have some answers. So please just keep praying for her. I don't know what to do. I really don't. Thank you, guys.